Hello viewers. Welcome back to our ongoing discussion from Content Managers Talk 41, where we delved deeper into the critical topic of triglycerides are more dangerous than LDL cholesterol. In this segment, we will explore 10 warning symptoms of elevated triglycerides paving the way for enhanced cardiovascular health and metabolic vitality. Let us refresh our knowledge about triglycerides first. Triglycerides are a type of lipid fat found in your blood. When you eat sugar and carbohydrates, your body converts any calories it does not need to use right away into triglycerides, which are stored as fat in the body. Later, hormones release triglycerides for energy between meals. Triglycerides are essential for health, but elevated levels can increase the risk of cardiovascular disease and various other metabolic disorders. The researchers explored the impact of dietary fats and carbohydrates on triglyceride levels. It was found that diets high in sugars and simple carbohydrates could lead to elevated triglyceride levels, while diets rich in unsaturated fats and complex carbohydrates could help lower them. Carbs, glucose plus fructose convert into triglycerides with the help of insulin. Excess triglycerides are stored in the body as fat. Understanding triglyceride elevation. Triglyceride levels can rise due to genetic predispositions or acquired factors. Genetic hypertriglyceridemia, stemming from familial elevation, demands lifelong management owing to its early onset and consistent elevation. Conversely, secondary hypertriglyceridemia arises from diverse factors such as medical conditions, dietary choices, or medications necessitating tailored interventions for optimal control. Unveiling silent risks. Triglyceride elevation often remains asymptomatic, posing a silent threat to health. Hence, recognizing the symptoms and signs of raised triglycerides is paramount for timely intervention and prevention of unforeseen health complications. Coming over to 10 most common symptoms of raised triglyceride levels. Number 1. Yellowish fatty deposits around eyelids. The appearance of small yellowish fatty deposits around the eyelids serves as a visible indicator of elevated triglyceride levels and lipid imbalance, prompting the need for effective remedial measures. Number 2. Raised lesions. Lesions appearing on joints or skin folds, particularly in clusters, may signal severe hypertriglyceridemia or underlying metabolic conditions, necessitating further evaluation and intervention for optimal management. Number 3. Corneal arcus. Accumulation of lipids around the cornea, termed corneal arcus, can indicate lipid abnormalities, especially in younger individuals. While typically benign, its presence underscores the need for comprehensive health assessment and management to mitigate cardiovascular risks. Number 4. Lipemia retinalis. This rare condition, characterized by creamy discoloration of retinal vessels due to severe hypertriglyceridemia, emphasizes the systemic effects of elevated lipids, warranting investigation and intervention to mitigate associated cardiovascular risks. Number 5. Central obesity. The accumulation of abdominal fat, termed central obesity, is closely linked to elevated triglycerides and heightened cardiovascular risk, highlighting the significance of targeted interventions to address metabolic imbalances and promote overall health. Number 6. Pancreatitis. High triglyceride levels may be linked to severe or repeated bouts of pancreatitis, an inflammation of the pancreas. Severe abdominal discomfort, nausea, vomiting, and fever are signs of pancreatitis. Pancreatitis can be exacerbated by elevated triglycerides, especially in those with extremely high levels. Number 7. Xanthoma palmaris. This disorder causes patches or streaks of yellowish color on the hand palms. Xanthoma palmaris is a less common symptom of lipid problems, although it might be a sign of underlying dyslipidemia, particularly high triglycerides. Number 8. Eruptive exanthemas, these are tiny, red or yellow pimples that frequently occur in groups on the skin. Eruptive anemomas can develop on the back, arms, legs, or buttocks and are usually linked to severe hypertriglyceridemia. They may hurt or itch and may resolve with treatment of the underlying lipid disorder. Number 9. Acute stomach pain. Severe stomach pain that may extend to the back is a symptom of acute pancreatitis, which is caused by elevated triglycerides. In addition to other symptoms including nausea, vomiting, and fever, this pain is frequently abrupt and severe. Number 10. Weakness and fatigue. People with noticeably increased triglyceride levels may report feeling weak, lethargic, or fatigued. This may happen as a result of excessive triglyceride levels' metabolic impact on the body's ability to produce and use energy. When these signs and symptoms occur with existing indicators of lipid problems, they may point to the need for additional testing and management of triglyceride levels to reduce the risk of linked health complications. Follow the Content Manager's Talk 41 for effective remedial measures. See a doctor if you experience any concerning complications so they can provide you with a proper diagnosis and treatment plan. Thank you for joining us in this enlightening exploration of triglyceride-related health concerns. Stay tuned for more insightful discussions and practical solutions to safeguard your well-being. Do subscribe, like, and share to your friends and family for their benefits. Take care.